Hello, it's Adrian Baker here from Lumia MediSpa. Just wanted to chat with you today about the risk side of having Profhilo treatment. So I'm sure you've heard about all the wonderful things that Profhilo can do for your skin, but I'm here today to just balance out that with some of the risks of the treatment. So firstly, thankfully, Profhilo has been around now for 10 years and is something that has an incredible safety record. Despite this incredible safety record, there are still some things that you should be aware of. So Profhilo is injected with a needle into the skin, and so you may potentially get some bruises. Every injection is a potential bruise, so you need to plan socially and sensibly that you may be walking around with a bruise on your face. So please don't have anything really important planned for at least a couple of weeks afterwards. Immediately after the treatment, the hyaluronic acid of Profhilo will actually be sat just under the surface of the skin, and this will create 5 little bumps on each side of the face. So again, you're going to have that for around about 24 hours. So you don't want to be doing anything that's too important visually, where people are going to be seeing you or going out to an important event. So again, please plan sensibly. Similar to dermal fillers, and although there's never been a recorded case of this happening, Profhilo is still a hyaluronic acid gel. And so if it was to be injected into a blood vessel or an artery, it could potentially cause some stagnating of that arterial flow and then potentially stop the circulation to the skin. Because of how it's injected and the areas that we inject, it's very, very, very unlikely for that to happen. But again, I always like to explain to my patients it's a possibility. It still carries the same risks. As with every injection, you always have a potential risk of an infection. As we inject the needle into the skin, we potentially could take some bacteria in with that and cause an infection. So this is prevented by us, or as much as possible, by making sure that we're thoroughly cleansing your skin, making sure that there's no makeup on your skin, and that we're using usually something called Clinisept to really reduce the bacterial load on the skin where we're going to be injecting. If, however, you do notice that you've got some redness or inflammation or anything that's extreme or pain, then please do reach out to us straight away. It's really important. It may just be normal within the first sort of few hours or something like that. That's likely just an injection related thing, but it's always best that you just check with us, certainly if it's after more than a day. As with any regenerative treatment, there is always a risk it might not work. So these types of treatments, like Profhilo or polynucleotides, are there to actually work with your body, and your body is the variable. So from person to person. So for one person, it may work really, really well, and they have a really lovely, smooth, hydrated skin as a result of having Profhilo. And for some people, the body just doesn't respond to it as effectively, and they may not see an appreciable result. So do always bear that in mind. These things cost a lot of money, but it is a risk that you do take, and we will always try and work with you. And part of that consultation is also explaining that results can never be guaranteed because they do rely in part on your body responding to the product we're placing in your skin. So I hope that helps. As you'll see with Profhilo, it's a very, very safe treatment. And so please do book in for a consultation if you would like to chat more about this, and we can explore it further. Thank you.